Positivity in the, what we call the microcluster zones, yellow, orange, red. 5.2 statewide without the positivity, without the microcluster zones is about 3. Overall, positivity with those zones, 3.6. We did 173,000 tests. What does that mean? We do more tests than any state in the nation, more tests pro rata than any state in the nation. So we just have more data to make decisions on. And that's a welcome relief. You know, everybody has an opinion on COVID. We have facts that we deal with on COVID, and that's the way to make decisions based on facts. 41 people passed away. That number has been going up steadily again in this new phase, and they're in our thoughts and prayers. Statewide hospitalizations has been going up steadily. It's up 126, 2,900. Number of people in ICU beds, number of intubations up. We know what this means, right? The positivity rate goes up. That means you're going to see the hospitalization rate go up. That means you're going to see the intensive care unit number go up. That means you're going to see the intubation number go up. That means you're going to see the death rate number go up. That is the progression. People get COVID, they're home for a few days, they get worse, they go to the hospital, they go to the ICU, they're intubated, and they pass away. So we know what these numbers mean. We've been here. We've seen this movie. Why do healthcare officials say that we're now in a dangerous period with Thanksgiving? Because two things. One, the COVID rates are already increasing. You saw it increase today. You've been seeing it increase over the past few weeks. Now, we said the COVID rate would increase over the fall because that's what was diagnosed. All the experts said you get into the fall, what you're going to see is the weather gets colder, college students are going to be coming home, and college students will be coming home from other states. They'll be bringing the disease with them. There'll be fewer outdoor gatherings because it's cold, so people are going to be coming inside, and the COVID rate will be going up. They diagnosed that for the fall, and that is exactly what we're seeing. We have tremendous increases statewide here in Rochester, in Monroe County, that have been going up through the fall. We expected it. We knew it. We now have an added problem that we run into Thanksgiving. Thanksgiving will be an added accelerant. Why? People travel, more social activity. The more social activity, the more the infection rate goes up. We know that. What was the point of the close down? The point of the close down was reduce the social activity, reduce the spread. What's the inverse of the close down? Thanksgiving holiday. I'm going home to see my family. And that's exactly what has been happening. The travel is way up. The hospitals report, the airports are reporting travel that is way up. And we're going to see an increase post-Thanksgiving. We expect that. That is going to take a bad situation and make it worse because the numbers were already going up. We then have increased Thanksgiving travel. That's going to be an additional accelerant. Those numbers are going to go up again. Those are the facts of where we are. How much do the numbers go up over Thanksgiving? Nobody knows. It depends on how people perform. If you look at the facts we know, the increase in air travel, we expect there will be a significant rise. When do you see it? You'll see it about 10 days after Thanksgiving. Again, you get the virus. There's a period where the virus is growing in your body, and it can be 7 to 10 days before you actually see the symptoms, you get sick, and you move to a hospital, and the hospitalization numbers go up. But we expect that. The global experts have all basically been recommending the same thing to us now, which is start to develop what they call a winter plan. We have been dealing with COVID in phases. We had a summer phase, we had a fall phase, which we're in, and we're going to move into a winter phase. And the experts have advised us to prepare a plan for the winter. And that's what we're going to be doing. So to give you some aspects on the winter plan, December, January, February is what we're looking at. First thing we want to do as we're preparing the plan, prioritize highest infection rates with the highest hospitalization rates. What is the greatest fear during COVID? Greatest fear is you overwhelm the hospital system. That the infection rate goes up so high, the hospitals can't keep up with the hospitalization rate. We're going to take a serious look at that hospitalization rate increase. We have an area in the state, Staten Island, where we have already opened a field hospital. I've been talking to governors across the state. They are across the nation. They are starting to open field hospitals again. Massachusetts is opening field hospitals again. This is reminiscent of the bad old days, right? When you had these emergency field hospitals that looked like something that you would see in a World War II movie.